When I first started this journey, working with practices 18, 20 years ago, it was a rarity that we had practices that even offered fluoride treatment to adults. It always takes us a while to catch up with the science. We didn't know that fluoride provided a benefit to adults until the late 60s, right? So that's why many patients still today don't have clarity on that. But now we know that there's tremendous benefit to adults with fluoride. And we don't have time to get into all of the science, but when we spend a full day on maximizing the role of preventive therapists, we get into all of the science. But here's often what I hear. I hear things like, we should probably do a fluoride for you. Insurance doesn't cover it. What do you want me to do? And that's if we're offering it at all, right? If I'm the patient and I don't have any benefit to me, if I don't understand why I need the fluoride, why would I accept it? Especially if it's an out-of-pocket expense. So that's what we focus on with your hygiene team, helping patients understand not just what we're wanting them to do, but why they should do it is critical. And helping your hygienists understand what to offer, why they should, what's the science behind it, what is the study, what do the studies show, what have other professionals found when they apply these principles in their office, and then how to talk about it. That's such a critical element, how to propose this service in such a way that patients say yes and move forward. That's often what is missing. I can't tell you how many times dentists will come to us and say, hey, Wendy, I heard you speak. I went back and told my hygienist, we should do fluoride on adults. And they were game for the first day. And then by noon, no one had said yes. And they said, oh, this doesn't work. Moving on, right? What they were missing was the how. So once we address that, I'm going to give you a quick run through. Here's how we help motivate and coach hygienists to improve their acceptance of fluoride when it comes to patients. We teach them to listen for those verbal cues of frustration, anxiety, anything like bad teeth run in my family. We're going to use that. And then we always lead with this phrase. This is such a critical phrase. New research shows. This is so important because if you haven't offered fluoride to adult patients as a matter of routine, or if it's something you only offer to patients that presented with rampant caries, or if it's something that hasn't been consistent, or if you're dealing with a patient who's declined it in the past, you got to lead with new research shows. And what we often cite is Dr. Gordon Christensen, CRA research, published an extensive article a few years back and stated with fluoride varnish, you can prevent up to 75% of your future cavities by doing fluoride consistently every time we polish teeth. So that's often what we'll say. New research shows that by doing fluoride more consistently, we can prevent future cavities by as much as 75%. Earlier, you mentioned that bad teeth run in your family. As I look at your record, we really haven't been very consistent with fluoride. Here's one thing we know. If we're consistent, we can minimize future cavities by as much as 75%. And given your past history, given what I'm seeing in your mouth today, here's why you should have this, right? I just segued right into the second step, which is explaining benefits and making it personal. Based on your risk status, this is something that I feel you would benefit from today, okay? The third step is good news, bad news. The bad news about fluoride for adults is that insurance often doesn't help. The good news is that it's often very affordable, right? We keep the fees low, especially in context, right? When you compare a fluoride application with a root canal, buildup, and crown, it's really irrelevant, the cost, okay? So these are things that patients need to know. And I can tell you when we have hygienists follow that process, the transformation in patient acceptance is powerful and immediate. Okay, and you might think, well, gosh, it's fluoride. What kind of impact does this really have on hygiene productivity? Well, we just do some simple math. Dr. John said he's a math person. I'm really not. I joke about the fact that that's one of the main reasons I am a hygienist, because there's not one college level math course required as a part of the curriculum. So I was like, yep, that sounds good to me, right? But we can do some simple math. Let's say we have 8 patients a day and our fee for fluoride is $29. Over the course of a year, the impact is huge. It's actually more than $44,000 in production per full-time hygienist. So practices that have multiple hygienists, I think there's somebody on here at least that has three hygienists in one location looking for a fourth, right? Those practices see a powerful impact from just this one preventive service, right? So, and here's some impact proof of that, the power of it. Here's a practice that had done 77 fluorides a month before the coach got there. The month after, they did 141. So it's a powerful and immediate impact when they have what they should do, why they should do it, and the toolkits, the systems on how to get it done.